Heart disease is America's #1 killer. Fatty deposits called atherosclerotic plaque build up in your arteries, including the coronary arteries, which supply the heart muscle with blood. This process occurs over decades, slowly encroaching on the space inside the arteries and restricting blood flow. This restricted blood flow leads to chest pain, known as angina, especially if people exert themselves. If the plaque ruptures, a clot can suddenly block the artery, damaging or killing part of the heart muscle. If the clot occurs in one of the arteries that supply the brain, it causes a stroke. A groundbreaking prospective randomized controlled trial was conducted over 1 year to determine whether comprehensive lifestyle changes could affect atherosclerosis. 28 patients were assigned to the experimental group, which included a low-fat vegetarian diet, no smoking, stress management training, and moderate exercise. 20 patients were in the control group, which means they followed their doctor's usual advice. The patients underwent a coronary angiogram before the trial and about a year later to measure the amount of plaque in the vessels. The experimental group patients were asked to eat a low-fat vegetarian diet, including fruits, vegetables, grains, legumes, and soy, without caloric restriction. Researchers did allow egg white and 1 cup per day of non-fat milk or yogurt. The diet was about 10% fat, 15 to 20% protein, and 70 to 75% mostly complex carbs. Patients were asked to exercise, usually walking, for at least 3 hours per week. Patients were also taught stress management techniques and provided a twice-weekly support group. The experimental group had average diameter stenosis, meaning how much the vessels were narrowed, decrease from 40% to 37.8%, while the control group stenosis increased from 42.7% to 46.1%. When only the worst lesions were measured, meaning those that were greater than 50% occluded, the experimental group's vessels went from 61.1% to 55.8% occluded, while the control group increased from 61.7% to 64.4%. And remember, this was after only 1 year. Also, because perfusion, which is the amount of blood actually getting to the muscle, is a fourth power function of coronary artery diameter, small changes can have big effects on functional status. So in this graphic, you see going from a 1-inch pipe to a 5-inch pipe doesn't increase flow from 21 gallons per minute to 105 gallons per minute. It increases it to 500 gallons per minute, and the effect works the same in your blood vessels. Researchers also tracked adherence, meaning how closely did they follow the diet, exercise, and stress management guidelines. The results show a dose-response mechanism, as you can see on the vertical axis of this graphic. That those with the most adherence averaged more than 4% decrease in stenosis, relative to the average 2.2% decrease for the experimental group as a whole. Of course, why is this study not in the news? Why is it not getting major coverage with all the media related to diet and health? Because the study was published in 1990. Really? We've known for 27 years that simple lifestyle changes can reverse heart disease and prevent many of the nearly 400,000 deaths in the United States each year. And that doesn't count the nearly 130,000 deaths from strokes and 85,000 from Alzheimer's. Yes, Alzheimer's, and I have plans to do a video on that at some point. Nor does it count the thousands of survivors of these preventable diseases whose lives are irreparably damaged. Because the study was done so long ago, we also have the results of the 5-year follow-up. As you can see, the control group had a massive increase in the coronary artery stenosis, while the experimental group made additional small gains. Keep in mind that the control group was still under normal treatment by a cardiologist, and some were on cholesterol medication. But why did the experimental group only make slight improvements from year 1 to year 5? Again, the answer is adherence. Those who had the most adherence to the diet plan averaged almost 7% decrease in coronary artery stenosis, while those with the least adherence were barely negative. It works if you do it. The answers are out there, and they're simple. For more information, visit nutritionfacts.org or go to pcrm.org and sign up for their 21-day Kickstart program. I'm not paid by these guys. I just think they do good work. Take care of yourself. Take care of your family.